Look, a pool. Wait, I can't even get into the water.
Are you experiencing any abdominal pain, fatigue, or headaches? How about deterrent motor skills?
You might think it's just work, but these are some of the underlying symptoms that cause what's known as Turcot Syndrome.
And what about cafe alliat?
Cafe what?
Cafe alliat, you know, the dark spots that show up on your skin.
No, what does that mean?
Well, I'm glad you asked.
It means it's time to talk to your doctor about Turcot Syndrome.
Huh, what?
Hey guys, so today we're out here in EMSA and we're going to discuss Turcot Syndrome for our MCB project. So Turcot Syndrome is actually a condition of the colon where there are multiple benign tumor formations in glands and colon polyps.
These tumors are linked to the formation of both colorectal and brain cancer, along with a multitude of other diseases such as Lynch syndrome and FAP, or familial adenomatous polyposis, which would explain the deterred motor skills.
So Lynch syndrome is actually a type of hereditary non-polyposis colon cancer, which can lead to other types of cancer in the skin, stomach, and brain.
It could also cause the development of adenomatous polyps, which are benign tumors within the gastrointestinal tract, later leading to growth in the central nervous system.
Yeah, so I hope that video helps you understand what Turcot syndrome really is, and like, subscribe, comment, down
See you
below.
later.
Bye.
And how many other people have this disease?
So only about 150 cases have been reported in the history ever, so basically you're special.
Great.
Both males and females have an equal chance of getting Turcot syndrome.
So I'm not that special. Is there anything I can do about it?
Of course! All infected persons need to go immediately to the doctor and get tested. So this is a genetic disease, so they will perform a sigmoidoscopy on you, which is a regular screening until around the age of 35 or 40 to examine your rectum and sigmoid colon. A sigmoidoscopy is recommended for anyone with an affected parent.
But you have to go as soon as possible, because advanced forms of the disease can lead to diarrhea, bleeding from the rectum, and in extreme cases can even lead to secondary brain tumors. There are also many other forms of testing that we will quickly gloss over.
So, an X-ray is used to test for the presence of polyps. So polyps are these little balls of mass that will develop into cancer.
A colonoscopy is when a colonoscope, which is a long and flexible tube, is inserted into the rectum to view for examination. And a biopsy is when some of the tissue is surgically removed to test.
And because it is genetic, there is a type of genetic test that can be performed, which is known as single gene testing. Sequencing accounts for about 90% of found cases.
The single gene test sequences the DNA of the region to test for mutations. Furthermore, 8 to 12% of cases are found through doing a deletion-duplication analysis of the APC. It includes analysis of the regulatory and promoter regions as well.
So once you do get tested, you will find out which type of Turcot syndrome you have.
The type of syndrome you have is determined by the genetic mutation that is causing it.
Yes. So type 1 of Turcot syndrome is actually autosomal recessive, and it's known as the true Turcot syndrome. So, for example, if you have one homogeneous parent and one heterogeneous parent who both carry the Turcot syndrome, then you have a 50% chance of obtaining this disease, because it means an autosomal recessive disease means that you must inherit 2 of the same alleles, each from different parents. Turcot syndrome type 1 is caused by DNA mismatched genes. MLH1, which is on chromosome P21G. So chromosomes are split up into is on chromosome 7p22. So because type 1 usually is characterized by having less than 100 polyps, it means that these polyps are generally larger and more malignant.
So type 2 is the more common autosomal dominant gene, which means that only one allele needs to be present for the disease to be inherited. So when we're talking about the alleles, we're talking about alleles of the APC gene, which is a tumor suppressor gene. So doctors are looking to identify a heterozygous germline pathogenic variant or some variation of the genetics of APC to determine whether there is a mutation or allele variants and what they are causing.
We've been talking a lot about this APC protein. How exactly does it cause this disease?
So this is an anti-apoptotic pathway that depicts what happens when there's a mutation in the APC. So when the APC is mutated, it's able to bind to this APCR receptor, which activates many anti-apoptotic effects, such as activating BCL2, which is an inhibitor of apoptosis, or inhibiting MAPS, which is an activator of apoptosis, which either way inhibit apoptosis from occurring, leading to tumor formation. On the other hand, if you had a normal APC protein, it would not be able to bind to this APCR, which would eliminate all of these anti-apoptotic effects, activating MAPS to be able to go through apoptosis and lead a normal cell cycle.
And since it is dominant, a greater percentage, about 75 to 80% of the population with the APC-associated polyposis diseases have an affected parent.
And there's a 50% chance that if you do have an affected parent, you will inherit the condition.
So that's not even half of it. FAP is another secondary disease that, along with Lynch syndrome, develops as a result of Turcot syndrome. If this isn't the first time you have seen colon polyps, there's a good chance that you can have FAP because thousands of adenomatosis colon polyps develop as early as age 16, with a 95% of patients showing signs of polyps by age 35.
You're saying that even though it's developing now in my 20s, there's still a good possibility it could be FAP?
Yes, definitely not out of the question. And this one, if you don't get treated, will almost certainly develop colon cancer by the age of 39. But don't worry, this condition is also caused by a faulty APC. So when you get your genes tested and sequenced for the Lynch syndrome, they will test for this one too.
Well, thanks. But my doctor just determined that I do have the APC mutation or Turcot syndrome, and it has progressed quite far. He gave me a list of treatment options, but I just don't know which one to pick.
Proctocolectomy! So although it does require surgery, it removes both the large intestines and the rectum, which prevents malignancy.
Other options encourage latency, which is the reappearance of cancer cells. For example, ileoproctoscopy is a surgery which removes the large intestine and then takes the rectum and connects it to the small intestine.
And although the patient has a better quality of life, they end up at a higher risk of their polyps progressing into cancer.
An ileostomy takes out the rectum and connects the small intestine to the abdominal wall.
A colectomy in general is a surgery that removes the large intestine. More specifically, an ileoanal anastomosis is when the small intestines and anus are connected.
Because of its low risk of cancer formation, which is the ultimate goal, a proctocolectomy is a decision you should make when weighing the treatment options for Turcot syndrome.
Beware. Side effects can include bleeding, blood clots in the legs and lungs, infection, injury to other organs, and tears in the digestive system connective tissue, which can lead to death.
Make sure you allow for some time for your digestive system to heal after your surgery, and talk to your doctor if there are any complications.
Look, it's a pool. I can finally swim. Now with protocolectomy, I can finally swim.
Now with protocolectomy, I can finally skateboard.
Now with protocolectomy, I can finally dance.
I live.
Oh my god, I live. I live for prolectomy.